Hello everyone, my name is Hayden William. I am a Concord University McNair Scholar. My mentor is Dr. Rodney L. Klein, and today I'll be presenting my study on perceived social support. So let's start by discussing what social or emotional support is. So within the literature, there are multiple definitions for social support, but it does focus on the emotional aspect of your relationships with other people. Some researchers feel it has more to do with trust or being empathetic when someone is in need, when other researchers claim it has more to do with being a caregiver for someone else, so providing your attention or reassurance for someone. But overall, the effectiveness of social support is determined by whether you are actually providing the needs that are desired by somebody else. So we see this a lot in clinical settings. So for example, a study concerning 63 patients that had recently completed chemo for ovarian cancer were assessed 3 times across the span of 3 months. At the completion of chemo, the anxiety, depression, and their perceived emotional support levels were assessed, and then this was done again 2 months post chemo and then 3 months post completion of chemo. And all the way across the board, they found that those that reported less social support from other people had the worst symptoms of depression and anxiety. So my research goal was to determine if levels of perceived social support were related to an increase or a decrease in anxiety and depression symptoms in undergraduate psychology students. And I chose that group of participants because there was a lot of variation in those participants. We have people with different majors, so it just helped me generalize. And I also had easy access to those students to distribute the survey that I created. So I created a survey using Qualtrics, and I combined 3 different scales and administered them using Qualtrics. So I combined the Beck's Anxiety Inventory, the Beck's Depression Inventory, and the multi-dimensional scale of perceived social support together in one large survey and distributed it. And what I found was that there was a correlation between the Beck's Anxiety Index scores and the MSPSS scores. There was a significant negative correlation between depression and perceived social support. So the worst, if you had low levels, if you reported low levels of perceived social support, you had worse depression. So you scored higher on the Beck's Depression Inventory if you reported low levels of perceived social support. There is also a correlation between the Beck's Depression Inventory and the Beck's Anxiety Inventory scores. So the worse your anxiety was, the worse your depression was, or vice versa. So what I found is that there was a significant negative correlation between anxiety and the level of perceived social support, and that there was also a significant negative correlation between depression and the levels of perceived social support. So both of the hypotheses that I had were supported by this study. And the reason the study was significant is because it highlights the fact that there is a lack of social support among undergraduate college students, and that seems to play some sort of role in the depression levels of undergraduate college students. So the study also demonstrated that there was a relationship between depression and anxiety levels in undergraduate college students as well. So this study really showed what the struggles are within some of the student body. So mental health seems to be a problem since the anxiety and the depression scores were so high, and that there is a lack of social support. So in conclusion, what we can do and what we've learned from this study is that we can actually help college students by maybe engaging them in more social activities on campus, more clubs, and that this may help their mental health, their depression levels, and their anxiety levels. So that is the main takeaway from this study, is that due to knowing this now, we can better help students by engaging them in more activities and providing more social support. These are my references. Thank you very much.